everybody. Since I've been out of the loop for so long, there's a lot of pent up things inside that I need to release, so I'm gonna go ahead and do that. And this one is pertaining to dentists. This is my advice to dentists. I'm a patient. I'm not an expert. I understand you've got a difficult job. I get that. But I also understand that you don't get a lot of time to speak one-on-one with the patient. So I thought that it would be nice to offer my insight as a patient on what I think could be done to improve the overall experience for everybody involved. I've had both good, really good, and really bad experiences. So I've kind of compiled a list. I have notes this time of things that I think that could be done to improve the quality of the appointment, the overall experience for everybody. So keep watching. The first thing is phone etiquette. The person who's answering the phone is the first point of contact for the patient. It is the first impression of your business. If I call a place and they're being very short with me or rude or hacking into the phone or having side conversations with their coworkers, I'm gonna be like, I'm not gonna trust you people with my mouth. Like, are you crazy? Like, this is expensive. It's probably gonna be painful. I'd rather just go down the street somewhere, you know? So that is crucial. Know what your receptionist is doing at the desk. Make sure that you talk to them about having good interpersonal skills. Chipper, upbeat, positive attitude. They are going to represent your business before the person even walks into the door. The second tip I have involves wait time. Now that I kind of understand what, a little bit more of what's involved, I get it. There's things that come up that are, unforeseen circumstances, things that are beyond your control, and that is through no fault of your own, that sometimes we as patients have to wait a little bit longer than expected. But what I don't understand is why it's so difficult to have somebody that's behind the counter go out and take 60 seconds to go out there and say, hey, look, I'm so sorry. I know your appointment time was at 10. Dr. So-and-so ran into some things in the back that we didn't, really anticipate. Can I get you anything? Would you like a bottled water? You should treat patients, clients, anybody like that as guests in your home. If you're having company come over to your house and your practice is your house, of course, you're going to have it clean. You're going to prepare the place for them. You're not going to have them sitting on a dirty couch and stuff all over the coffee table and just leave them hanging in there fending for themselves. You're going to accommodate them. You're going to say, okay, well, if you need to use the restroom, it's right over here. Could I get you something? Are you thirsty? Do you need a glass of water? That's not that hard. It's not that hard. And it really is appreciated probably a lot more than you know. I cannot think of anything worse than having an appointment at a specific time and I'm sitting there and I see people going in and out and I'm just there did you forget that I'm here? Maybe they forgot. That's what I'm thinking. Maybe I should go and remind them that I'm still out here. Did they not see my name signed in? What's going on here? Because I'm the kind of person that will not allow a person to sit there waiting for me. I will let them know. If I have to do something else, I'm going to let that person know. The third bit of advice that I have is to give the patient a chance to speak. Hear them out. A lot of people have messaged me saying that, they never liked the wax try-in. But the way that the dentist was communicating with them was kind of it was very bombarding. Oh, don't worry. You say you don't like something, but they're oh, it looks amazing on you. God, I can't get over that. Hey, come in here, check this out. You're on the spot. We're nice people. We don't want to look at you and say, whoever's responsible for these just did not nail it at all. I had that experience. Some of you remember that video. It was a bad experience because I'm looking at myself and I'm under no circumstances would this look okay. I understand that beauty is subjective and everybody, thinks, differently about what looks good and what doesn't. So while some dentists may genuinely think, I think that looks great on you, and the patient's not so much, hold on there. In the circumstance that I was in, the situation that I was in, it was under no circumstance should this be acceptable work. And he was sitting there saying, wow, it looks great. He looked really proud of it. I felt so bad having to tell him, this is all wrong. I can't see anything right with this. And I had to get a refund. If somebody's saying, I really don't like the way that this looks. You need to listen and you need to work with them. I understand that there are some patients with asinine requests. You do not work black magic. Let them know what's possible. If they're requesting like these $10,000 dentures that are worth like $10,000 and only wanting to pay $2,000, well, that's not reasonable. But they need to understand that. The only way that they're going to know that is if you're openly communicating with them and sharing information and trying to help educate them. The next thing is about empathizing with the patient, and I just can't stress this enough. I think that on some level, pretty much all of us have some kind of fear or at least apprehension about going to the dentist. I don't think I've ever talked to somebody personally that said, I love it when I have a dentist appointment. It's just they're going to feel uncomfortable. They might be experiencing pain. They're going to be spending a lot of money. It's just not a very pleasant experience. And so there is some fear involved there. For instance, the patient that says, I don't like shots. Oh gosh, I hate shots. I never have liked them. And they just start getting all weird about, something that is pretty much routine in dentistry is the shots. And you're probably sitting there, thinking, duh, who does like shots? You know what I'm saying? But I don't think that's really what they're saying so much as, they're trying to communicate, I need some reassurance. I'm a little bit nervous right now. I'm anxious. I'm worried about if this is going to hurt me or not. Not just the shots, just everything. That's your opportunity. When they start saying stuff like that, which I'm known to do, totally. They're just looking for some compassion and understanding and some reassurance. Just, I understand this isn't comfortable at all. I get it, but it's going to be over really quick, and I'll try to go, as gentle. I'll try to be as gentle as I possibly can. I'll do what I can to keep you comfortable. Just those reassuring words. It's kind of like your mother coddling you as a freaking infant. It does help. It really helps. But when you've got a dentist that is just ticked off and ready for you to be up out of there, it makes you very nervous and it makes you tense up, which leads to my next part of that is you're required to open wide. But the thing about that is that, for one, if the patient has a mouth like I had, they're not going to want to open up wide because that's something they have trained themselves not to do. So just these are muscles that they're not even utilizing on a daily basis, and you're just asking them like on the spot, open wide, and then they're not able to do it. A lot of the times it's because they're just tense and they're anxious. If you would go those extra steps to keep that person comfortable, to let them trust you and trust that you're doing everything you can to keep the pain as minimal as possible and to give them a good experience, I feel like they're going to be a lot less tense. They're going to be able to really focus on what you're asking them to do. They will open wider. When you say turn or bite down, they'll do that with ease because they feel comfortable and they don't feel so tensed up. Keeping them comfortable, it's just little things. When I went to Dr. Golpa in Las Vegas, one of the things of all things that just really has stuck with me, when I was in the operating room, they came in and asked if I would like a blanket. Nobody's ever done that for me in a dentist office. You probably don't even think about it because you're up busy running around, but the patient is just sitting there like frozen still. The gesture of saying, hey, would you like a blanket? Are you cold? Are you okay? It makes them feel very relaxed, like they're in good hands. One thing that Dr. Martin did for me was he offered to play a Pandora station for me. So he created a Beatles station on Pandora, and we listened to like Beatles and the Rolling Stones and all that stuff. And it just felt more like I was in a home type of environment, because this is the music I listen to when I'm cleaning my house. You know what I'm saying? And so to be able to listen to that and hear songs that I like, it kind of took my mind off of things that were a lot more anxiety inducing. So just little minor things like that really do go a long way, and they're very much appreciated. The next tip that I have is to, and I can't believe that I have to say this, but unfortunately I do. I was prodded for information on whether I did drugs or not, and that is not uncommon. It just is so offensive to me and to a lot of people, whether they are or not. Like, that's none of your business. You're not their doctor, you're not their like life coach, you're not their therapist. That's got nothing to do with what you're doing as far as I'm concerned. Don't go prodding them for information like that. Like, you know, are you on drugs? Because, like, would you want somebody to do that to you? A lot of people assume that dentists are crooks. It's just that small bunch that ruins it for everybody else and gives everybody else a bad name. But most dentists are awesome people, hardworking people. They deserve respect. They don't deserve somebody coming in there accusing them of being a crook and only wanting to take their money. You know, wouldn't you be offended in that situation if somebody who doesn't even know you is accusing you of things like that? Keep those comments out of there. The next part about treating them with dignity and respect, and I have experience here, unfortunately, do not ever send them out into the waiting room with no teeth. Ever. That happened to me. They tried, it was horrible. They tried to send me out into the waiting room without my teeth. You know, and I don't care how old you are, but I was really young, you know. Of course I don't want to like go out there without my teeth, but no matter what age you are, 75-year-olds, they don't want to be seen without their teeth. That is so awkward and embarrassing. I can't even believe the audacity of these people to think that that's even okay. Don't ever do that. One suggestion that I have for you is that if a person has to go without teeth and you're doing other work and they're just sitting there and you're not working on their mouth at the time, offer them one of those surgical masks. I request them. And they got to where they would just give them to me because they knew that I didn't want to sit there and have to have conversations and I have no teeth in my mouth. You know, just something like that would make people feel like their dignity is being preserved. When a person has to sit there without teeth like that, it's not pleasant, because to you, you're kind of numb to that, like, because you see so many patients and you're so used to it, it doesn't even affect you at all. But for that patient, that could be extremely emotional and traumatic. If I had to go out in the waiting room, I wouldn't have done it. But for some people, to have to go out into a waiting room with no teeth around a bunch of people, that could be like a traumatic experience that will like literally scare them away from the dentist, like indefinitely, probably. The next tip that I have is to be very clear with your instructions. And I think as a rule of thumb, it's probably better to assume that they don't know what you're talking about, no matter what. No matter what they say, it's better to assume that they don't know rather than to assume that they do know. Because if you assume that they do know what you're talking about and they really don't, they could end up going home and like messing things up, like not following directions, like, because who knows, maybe they were too emotional to really focus on what you were saying in the first place. Maybe you spit out some jargon that flew way over their heads. And that's another thing. If you're going to use jargon at all, just be prepared to like give a definition, write it down so that they'll remember it. Because I've been in situations where I can pass as like, oh yeah, I know what you're talking about. I don't have a clue what you're saying, but I don't want to tell you that because it's kind of embarrassing. I don't want to admit that I don't know what you're talking about. I don't know. When you're talking about teeth, like, especially don't call them by their number or whatever. Don't even call them by their name. Just point to them. A lot of people don't know what you're talking about. No matter how much of a no-brainer it might seem to you, to us as patients, most of the time, we don't really know what you're talking about. Point to the teeth, say this tooth right here is the blah blah blah, and this is the tooth that we have a problem with and we're going to have to blah blah blah, which means blah blah blah. You have to really be thorough in explaining to them, because an educated patient, a patient that understands, is going to be the patient that is not calling you 5 times a day with questions. Any kind of informational pamphlets that a person can take home with them and read and reread, I am that person. I will read over and over and over again. Keep them in layman's terms. Very, very concise, very straightforward, in a way that pretty much anybody could understand. And that way they'll be able to better absorb the information that you need them to know. The next thing is website. If you don't have a website, you should definitely get one. It is 2016. We're all online now. My doctor's office has like this online patient portal where you can make appointments online. You can also message your doctor and they'll be able to get back with you within 24 to 48 hours, but typically within a day. They respond to my messages, and what that does is it cuts down time that a patient will spend in the chair, because some of these questions that people have could be very simple questions with very simple answers that it would literally take a few minutes just to respond to them online, rather than them popping up at your office and scheduling an appointment and taking up time that you could be dedicating to another patient that has like a real big problem. And we don't want to have to do that. We don't want to go out of our way to continuously go back over and over and over again asking these questions or calling your phone, blowing you up. So I just really highly recommend to get a website, make it very patient friendly. That's who needs to be able to use it. It's not to showboat and say, hey, look at all of the things I've accomplished. And that'll cut down time that they actually spend coming back in for things that could be easily solved online. And this is the last bit of advice that I have for you, and that is to let your work and your character speak for itself, because there are dentists everywhere. They're everywhere, all over the place. There, at least where I'm from, like, you are not going to run short on finding a dentist. But the thing is, while you may have like similar education, similar background, similar years of experience, similar skill levels, what's going to set you apart is, number one, the work that you do, because we are walking advertisements. You don't have to come up with any kind of marketing strategy or develop any kind of gimmicks or anything like that, investing money in, some kind of online branding and stuff. The patient's going to be your best source of marketing, because me, with these, I have been so pleased with these that I tell everybody. I mean, obviously I'm on YouTube, I have a bigger platform to do that. But if a person asks me in public, I will happily say, yes, this is who does the teeth. This is the dentist that I went to. Their reputation and the work that they do, it just really shines to where people want to talk good about you. They want to recommend you to their friends and family. That's typically how people find you, is through recommendations, whether it's with close family and friends or online resources like city forums and review sites. They're going to look at that and they're going to say, okay, well, these dentists look like they pretty much offer the same thing and they, have similar prices. But this dentist over here, everybody said that he or she was very pleasant, had like a really positive attitude. The staff was all friendly. The office was clean. I felt like I was at home. We're more likely to go there. Or to show pictures like, this is what this dentist did for me. Look at how amazing my teeth look. And people are going to say, oh, I want that. And they're going to want to go to you. So set yourself apart that way. Make sure that you are somebody that has outstanding integrity and character and compassion for the patients, because the competition is pretty heavy, and that's what's going to make you stand out among others. It's just the little things. I don't think anybody's expecting a dog and pony show. It's just little small gestures, kind words, compassion, reassurance, things like that will really go a long way, and it'll make the overall experience more pleasant, not only for the patient but for you, because if the patient feels comfortable with you and they're happy with your work and with your attitude, they're going to be recommending you to other people. They're going to be eager to come back and return for more work, and that's going to make your life a lot easier. So I hope this helps, and as always, follow me on Instagram. I am kalinjax on Instagram. You can find me on Facebook. It's Christy Lind and dentures. dentures.com, and make sure you subscribe to this channel so that you can get updates straight to your inbox. And you guys take care.